We all want a flat tummy, but how do you get it without going under the knife? I've got the answers for you on this video today. Thank you to Ombre Lab for sponsoring this video. My name is Dr. Anthony Youn, and I'm known as America's Holistic Plastic Surgeon. And on this video, we're going to cover how you can get a flat tummy without surgery. Now, the first thing that we want to consider is, why isn't your tummy flat? Is it due to bloating, or is it due to excess fat, or something else? Well, the first thing let's tackle is bloating. The easiest way to determine if you have a problem with either belly bloat or with fat is to look at when this happens. Fat is something that doesn't go up and down during the course of a day. You just have it throughout the whole day. Whereas bloating is something that definitely goes up and down, often depending on what you eat. Now, there are some people that will have literally a glass of water and will feel really bloated afterwards. And there are other people that really depends on what they eat. Well, the big key to treating belly bloat is to get your microbiome in order. Now, the microbiome are the trillions of bacteria that line your gut. And these bacteria can have a profound impact, not just on how your gut is functioning, but on so much else in your body. When your gut microbiome is out of balance, when it's filled with bugs that maybe aren't so good, that can definitely contribute to bloating. So the first thing that you want to do is to make sure that you populate your gut with good bacteria. Now, the American diet is pretty much devoid of fermented foods. Fermented foods are foods that contain beneficial gut bacteria, and these are foods like sauerkraut, miso, kimchi, kombucha, and yogurt. So by eating more of these types of foods, you're going to help populate your gut with the right bacteria to help reduce belly bloat. Another thing that can contribute to your belly bloat is eating the wrong types of foods. Dairy and gluten are two types of food that are horrible for some people if they've got bloating issues. So if you've got issues with bloating, just go for a couple weeks off of dairy and/or gluten and see how your gut reacts. There is a huge population in the entire world who is lactose intolerant, and having dairy for them can definitely get them bloated. So these are some of the food changes that you can make to help with belly bloat. But is there something easier that you can do? Well, yes, there is, and that is taking a probiotic. Probiotics are pills that you can take that are filled with beneficial gut bacteria. And what I usually recommend is a probiotic with at least 3 billion colony-forming units per day. But if you want to take that to the next level and really optimize what you eat and the probiotics for the health of your gut microbiome, take a peek at Ombre Labs. Thank you to Ombre Lab for sponsoring this video. Do you have a hard time maintaining a healthy weight no matter what type of diet or exercise you try? Or maybe you're dealing with bloating, constipation, or abdominal pain. Well, believe it or not, your gut may be to blame. Your gut contains trillions of bacteria, both good and bad. When your body doesn't have enough good bacteria, the bad bacteria can flourish, and this can create certain types of not so good symptoms. In addition to issues with maintaining a healthy weight or tummy problems, if you're struggling with a weak immune system, constantly getting sick, skin blemishes like acne and rosacea, or difficulties with daily happiness and mental health, and you can't figure out what the cause is, the answer could literally be found in your gut. Ombre Lab makes it really easy to measure your gut health by offering an at-home test that can measure the levels of bacteria in your gut. And they do this by testing your poop. The test will ship straight to your door with easy-to-follow collection instructions. And don't worry, it's all very sanitary. Upon receiving your results, Ombre Lab will give you a detailed breakdown of your gut bacteria, the health issues it may be causing, and what specific foods you should consume more of or less of to help improve your health. They will even develop personalized probiotics to heal your gut if you sign up for the subscription. So if you're struggling with any of the symptoms that I mentioned and you want to see if your poop has the answers, then visit tryombre.com/Dr. Youn. That's tryombre.com/Dr. Youn to get $30 off your test. There's a link in the caption below. So if your problem isn't belly bloat and it's fat, how do you tell what type of fat it is? Because the type of fat that you have will determine the treatment for it. We have two types of fat in our body, subcutaneous fat and visceral fat. Subcutaneous fat is a fat that you can pinch. It's the fat that's below the skin but above the muscle layer. Visceral fat is fat that's around your internal organs. It's inside your abdominal cavity and it surrounds organs like your intestines. One simple way to tell the difference between whether you have subcutaneous fat or visceral fat is to see if you can pinch it. In general, subcutaneous fat can be pinched between your fingers, whereas visceral fat is below your muscle layer and so it can't be pinched, and if anything, visceral fat causes your abdomen to look rounder. The classic example of somebody with a lot of visceral fat is a guy with a pot belly. If you ask most plastic surgeons, how do you get rid of subcutaneous fat, they're going to point you right to their liposuction machine. And yes, it's true that the most effective way to get rid of subcutaneous fat, short of diet and exercise, is to physically suck it out by liposuction. But not everybody wants liposuction because it is real surgery and it's invasive. So what else can you do? Well, there are a plethora now of non-invasive fat-reducing treatments. The one that I recommend most highly is called Sculpture. This is a laser that can target the fat cells, increase the temperature that those fat cells are at, and cause those subcutaneous fat cells to die off. The treatment is completely non-invasive, and studies show that after 1 to 2 treatments, you can reduce up to 25% of the thickness of your subcutaneous fat with Sculpture. Here are some pretty impressive results from a non-invasive treatment. Now, these results are good, but they're not quite the same as lipo. But what about visceral fat? Well, visceral fat is definitely more complicated, and visceral fat is a type of fat that is often stubborn, it's hard to get rid of. It runs in generations, so if your mom or dad has a lot of visceral fat, it's definitely possible that they can pass that off to you as well. And some doctors even believe that visceral fat can be very much related to inflammation, and that reducing the overall inflammation in your body can help you to reduce visceral fat. Well, unlike subcutaneous fat, you cannot liposuction visceral fat. There's nothing that I can do in the operating room to get rid of that fat for you. So you, unfortunately, have to do it on your own. But there are some shortcuts that you may be able to take with reducing that fat. Some preliminary studies are showing that fasting, whether intermittent fasting or doing different types of fasts, can help you to predominantly get rid of that visceral fat. There is a fast that I did a couple years ago called the fasting mimicking diet that studies show can preferentially target visceral fat as well. Now, this is a 5-day limited calorie fast. So you're actually eating during this time, but you're eating a very limited amount of calories. By doing this 5-day fast, you can lose anywhere from about 3 pounds to some people up to 15 pounds. And it's interesting because some of the studies are showing that some of this weight comes directly from the visceral fat. So we've talked about bloating, we've talked about fat, but what about a diastasis? Women who have children often end up having a diastasis, and this is a separation that can occur between the rectus muscles, which are the 2 paired muscles that come straight down the abdomen. This diastasis or separation can cause the tummy to stick out more than it otherwise would, and no amount of straightforward crunches can necessarily cause this diastasis to go away. So what can you do? Well, the first thing you can do is you can do the right types of exercises to help reduce it. And this video from my good friend Dr. Emily Kyberd will give you some very helpful examples of exercises that you can do to reduce your diastasis.
Hey there, Dr. Emily Kyberd here with Thyroid Strong. 100% of women that go to full-term pregnancy will experience separation of their abdominal muscles, the 2 sides of their abdominal, the rectus abdominis muscles, and that is called Diastasis Recti. It is normal, it makes space for the baby. Ideally, the 4 to 6 months after we have a baby, that rectus sheath would naturally close and the 2 sides of our 6-pack muscles would come back together. If after 4 to 6 months there's still separation, then there is some dysfunction and we need to strengthen the core after we have a baby to help encourage those muscles to come back together. So I'm going to show you 3 exercises to help do that. Sometimes there are postural things like lots of sway back or wearing heels or wearing the baby in a carrier on the front that can pull us into this excess sway, which will flare our ribs and create this separation of the abs. So all of the exercises are to encourage the ribs to come down and to help the abs close, all right? So start on your back. Knees are gonna be up at 90. So if they're at a true 90, like a Pilates 90, you'll feel an arch in your back, okay? So you want your knees hip width, feet are together. You want your knees a little bit above 90. That will help take the arch out. You're gonna grab your ribs, these floating ribs, and you're just gonna kind of coax them down. You can grab opposite sides. You're gonna take a couple breaths down and wide into your belly. Think of it as your tank of strength, okay? You can start to challenge by doing a dead bug, tapping opposite foot down, thinking ribs stay down. If you start to feel your back arch, don't let it. So breath in here, keep a breath in, exhale as you pull the leg back to 90. Just remember, oftentimes you'll want to kind of go really fast for exercises. The slower you go, the more challenging it is. Slow is fast. All right? Second exercise, after we get these ribs down and we get the arch out of our low back, we want to start to engage our oblique muscles. So with our legs here, arms up towards the sky, you're gonna think as if you're rolling everything up towards your elbow and then rolling back down. Okay, so keeping this side nice and engaged. You would do both sides here. Right, and we do this as babies. We learned this at 4.5 months. Good. So even after 5 reps, that will feel really challenging. So the third and final exercise is on hands and knees. All right. So you're going to have your hands underneath your shoulders, middle fingers parallel, knuckles rooted down. You're going to take your elbow crease and point it towards your thumb. Notice my back is nice and long. It's not rounded. It's not arched. If you can maintain this nice low back, then you're ready for this exercise. You're just going to lift your knees off the floor and take 3 breaths. In a beast plank. Nice long neck, soft chin. Good, and then knees come down. Just making sure those ribs don't flare, that they are knitted down. So those are the 3 exercises to start to get your abs back, create this tank of strength, and start to close that diastasis recti.
So now that you know the exercises to help reduce your diastasis, what else can you do? Well, there are muscle stimulating devices that can also help you to reduce the diastasis. And these devices go by the name of M-Sculpt, Cool Tone, and True Sculpt. These devices help to stimulate your muscles to contract thousands of times per session. And by contracting those muscles, it can actually help reduce the diastasis. Studies show that with the M-Sculpt, you can reduce your diastasis upwards of 11% after 4 treatments over 2 weeks. So in this video, we have talked about how you can flatten your tummy without surgery. But what if you've got so much excess skin that surgery is really your only option? Take a peek at this video right up here where I show you one woman's journey through a tummy tuck. The surgery that was needed to get her where she wanted to be, her recovery, and a whole lot more. If you've been enjoying my videos, please subscribe to my channel. And always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.